today I am going to remove the catheter of my patient. Before that, I will read the scenario. Okay, after reading the scenario, I will check the scene is safe, and also I will do hand washing for 20 to 30 seconds following WHO guidelines, taking a palm full of alcohol hand rub, palm to palm, back of the palm with the fingers interlaced, palm to palm with the fingers interlaced, fingers interlocked, and tip of the fingers against the other palm and vice versa, and rotation rubbing of the thumbs and vice versa, and rotation rubbing of the wrist and vice versa. Now I am safe to approach my patient in a calm and professional manner. Hello, I am Alina. How do you prefer to be called?
You can call me Grace.
Okay, Grace, how are you now? Are you comfortable enough?
Yes, I am.
Do you need an extra blanket?
No.
Okay, and I will provide privacy for my patient, and also check the identity of my patient by asking name, date of birth, and hospital number, and check for any allergies. And Grace, today I am here to remove your catheter, and that is called trial without catheter. You may feel some post-catheter symptoms such as urgency, frequency, and discomfort due to the irritation of the urethra. But you don't worry, I am going to monitor you. And while removing the catheter, I want to expose your genitals. So, do you need any chaperone? Okay, and while removing that, you may feel some discomfort and pain, but you don't worry, I will do it as gentle as possible. Is that okay for you?
Yeah.
Okay, are you happy for me to do the procedure?
Yeah.
Is it the right time for that? Okay, now I am going to prepare my materials. Meanwhile, if you need me, please press the call bell. Here is your call bell, Grace. Okay. And I need a tray which is clean, dry, and disinfected. Accessory, is it safe for me to use? Yeah. Okay, I need an alcohol handle which is not passing the expiry date of 2025. It is safe for me to use. And I need an procedure pad which is clean, dry, and which should come from a packet which has an expiry date. Accessory, is it safe for me to use? Okay, and I need an gauze which is clean, dry, and intact, and not passing the expiry date of 2027. It is safe for me to use. And I will check the documentation for seeing how much ml of sterile water used for inflating the balloon. And Assessor, can I confirm it?
10 minutes.
Okay, I need a 10 ml syringe which is clean, dry, and not passing the expiry date of 2027. It is safe for me to use. And now I am going to wear my apron and gloves, a quick hand rub. Now I am going to approach my patient by minimally disturbing the curtains. Okay, Grace, I am back with the equipments. Are you still happy for me to continue the procedure?
Yeah.
Okay, and now I am going to expose your genitalia. Is it okay for you?
Yeah.
Roll down the blanket and rolling up the. In the real setting, I will clean the meatus and catheter using a saline soaked gauze, and also I will check the catheter is the urine bag is placed below the bladder level and above the floor, and if the urine bag is filled, I will remove the urine, and also I will enter it in the fluid chart. And now I am going to check the functionality of the syringe. This wrapper will go to the domestic waste bin later, and I am going to deflate the balloon. Okay, I will remove the syringe, and I am removing the leg strap. Okay, are you still comfortable, Grace? Yeah. Okay, now can you please take a breathe in and breathe out?
Okay.
Okay, and can you please do it once again? Okay. While you are exhaling, I am removing the catheter by giving a gentle traction. Exhale, please. Now I am going to check the tip of the catheter for any blood, X-ray and any signs of infection. There is nothing. And now I'm going to, Grace, now I'm going to change the inco pad. Are you okay with that? Yeah. Okay. Removing the inco pad. And I will clean the meatus using a saline soaked gauze. Grace, are you still comfortable?
Yeah.
Okay, you need to take more water, and that is you need to take 2 to 2.5 liter of water every day, and you need to continue with your penny care, and when you first void you have to inform me. Is that okay for you? Yeah. Okay, now I am going to remove the urine bag. This will go to the clinical waste bin later. Okay, and rolling down the gown and roll up the blanket. Okay, Grace, now I am going to do my aftercare. Meanwhile, if you need me, please press the call bell. Is that okay for you?
Yeah.
Here is your call bell. And all the things that touches the patient, including my gloves and apron, will go to the clinical waste bin, and all the wrappers will go to the domestic waste bin. I will do my final hand washing and final documentation.